Welcome to The Appetite, a podcast about all things food, body, movement, and mental health. Brought to you by Opal Food and Body Wisdom, an eating disorder treatment center in Seattle, Washington. I am Dr. Lexi Giblin, a psychologist and executive director at Opal. And today we re-release one of our favorite interviews from The Appetite's early days. At the time of this recording 3 years ago, Erin Harrop was a doctoral student in the UW School of Social Work, working on their dissertation on the life experiences of people with atypical anorexia. Now they are Dr. Erin Harrop and have taken a post as assistant professor at the University of Denver. At DU, their research agenda addresses weight stigma as a social justice issue by examining the systemic factors that impact eating disorder patients' access to quality health care. Julie Church, Opal's co-founder and nutrition director, joins Dr. Harrop in this conversation. And many of you may be missing Carter Umhau, The Appetite's previous host. She is in this one too. Enjoy.
So a few weeks back, we talked about health at every size as a movement. And one of the things I was really struck by was that to think about that movement and its place in kind of the conversation around bodies means that you're flipping a lot of assumptions on their head, just as a groundwork is being laid. Assumptions are being flipped. So when you're talking about kind of doing this different kind of exposure, art even, or advocacy work, what are the assumptions that you feel like you're breaking open?
So many.
Yeah.
I think in the beginning, there's a lot of assumptions about health, what it means to be healthy, what it means to, and whether or not even we should or have a responsibility to be healthy. So I think it's pretty commonly accepted, at least in this culture, in this time, that health means presenting in a certain type of body, a certain type of like muscular, athletic, toned but not too toned, and like thin but not too thin kind of presentation. And we have these guidelines that are set forth for us in terms of our body weight and our BMI that let us know, okay, this is what health is, and this is the type of body I should have. And I think a lot of the advocacy work that we do kind of questions some of those assumptions, and also questions the ethics of kind of prescribing a certain type of body type and a certain type of body, and then and prescribing behaviors to get that type of body. So a lot of our work in advocacy has to do with where does this preference for a certain body type come from and a certain body size come from? Does it come, what type of system is supported by that? Who benefits from that? And who benefits most from that? Because I think a lot of these expectations that we have benefit certain groups way more than others. And then thinking about how ethical is it to kind of continue to promote this certain perspective that's centered on weight at the expense of other things. And I think that one of the other things that we're trying to kind of flip on the head is this like responsibility to not just thinness, but also to health. I think, the health at every size community for a long time has kind of struggled with this idea that we want to shift the focus from weight to something. And I think maybe in the beginning we thought health, that's what we want to go for, because everybody can get on board with that. And then sometimes health and like ability isn't necessarily a choice that folks have. Like,
absolutely,
it's one of those things that ebbs and flows for all of us within our lifetime. We have periods when we're never sick and periods when we're chronically ill. We have periods where we can like be that amazing athlete that we want to be and we're like crushing it on the volleyball court or something. And then we have other times where we have a back injury and we can't move. And so this idea that like this kind of ultimate athleticism or wellness or healthiness is not only an option, but also a responsibility.
A moral responsibility.
That can be super problematic. And it, I'm always asking, like, who does it exclude and who's left out and whose experience are we saying is wrong? So I think some of those assumptions are things that we're kind of questioning and pushing back on a little bit.
I want to like write those questions down.
I know, I love
Wait,
that.
what did you say?
Well, I wanted to just ask you that question that you
okay.
just posed yourself. Whose experiences are being excluded? Who is getting forgotten about in this kind of mainstream paradigm?
Yeah. I was thinking about this on my way in. Because even in that question of who's being left out, we still often see it centered around like thin, pretty women who show up kind of in that margin, speaking for that marginalized voice. So I think I just saw a Facebook video of like a really pretty thin woman who had a back injury, and so her hair had gotten messed up, and they did this beautiful transformation for her with this haircut, and she went from like thin, beautiful woman with messy hair to like thin, beautiful woman with beautiful hair.
Gosh.
And there was this I was thinking about it as I was watching it. And I was like, okay, this is acceptable for this woman to be bedridden and to not take care of herself, partly because of her privilege. And how would this be if this was like an older fat woman, who was disabled and unable to take care of herself? What kind of assumptions would be put in there? And like, how much would this hairdresser be reacting with like disgust as opposed to, oh, we're going to get you through this, honey. And so I do think, for sure there are folks with chronic illnesses that we don't see that get left out. I think when we talk about body positivity and acceptance, there's cultures and people of color are not represented a lot in our white movement. Like we have, and I don't want to ignore the fact that there are a lot of advocates that are people of color that are doing great work, but it's not being centered in our
in the movement,
or at least in this one, the one that I see as a white woman.
Oh, okay.
So there's a lot of work out there that's being done, and it's by folks that I don't have as much contact with in my white world. So, and I think also like we see folks with disabilities left out, and of course people of size. And actually, I don't even really like that term a ton because we all have size.
Yes.
I think what we're trying to say is fat people. And I'm kind of saying that from the fat liberation meaning of the word. I sometimes tiptoe around that word with certain audiences just because people get afraid when I say fat people or but that's what I'm talking about.
Yeah.
So
yeah. And can you say a little bit more about kind of the liberation of that word in this context? I'm familiar with that, but I wonder if everyone would be, because it is such you say it and there's like it comes with kind of an energy around it, I think, when that word is often in a room. So can you lay that out a little bit?
Yeah, I think we call it the F word a lot in eating disorder treatment circles. And that speaks volumes, right? That this word is something that has been so pathologized that we equate it with cursing. And so, the fat liberation movement, there's a movement to reclaim this word fat. We see similar things in terms of other places, like for instance, in the queer movement, queer used to be used as a slur. And in, working with language, and we talk about like reclaiming the tools of the oppressor in feminist studies, particularly in feminist studies from people of color, we see this movement to try and reclaim language that has been used against a group of people when there's something redeeming about it. Now, fat as a term is it's a descriptive term.
Right.
It means that there's more of something. So I think in terms of fat people using fat as a positive or neutral or descriptive term, that's the way that I'm using it, in kind of that reclaiming way. There are other terms that we don't necessarily reclaim, that have caused like so much harm or been used in such a detrimental way that a lot of advocates say, no, there is no reclamation of that term. And so terms like that are things like obesity, like that's a term at least that I've heard tossed around, is like that we're not reclaiming that word. That has caused too much harm. So I think, this idea of like what language we use, how we use it, is a challenge. And like, who do you use it with?
Yeah.
Right.
When is it appropriate to use it? Is it appropriate for me to describe myself as a fat woman, depending on like how I'm perceived and like who's around me? And then, like watching my thin peers like react to that it can be, a challenge, because fat is a word that most people are uncomfortable with, and people will say anything to avoid acknowledging it. They'll say fluffy and chunky and heavy and curvy, and these are all euphemisms to get around
Fat.
saying this person has a larger body than somebody else.
Right. And it goes back to that idea being, it's pointing to morality, I would say, right? That if there's fatness and there's squirmishness around that word, there's an assumption that it's a bad thing. Yeah. Where instead of like everyone has some degree of fat on their bodies, and so it's a thing. Yeah. And it is part of the body. Yeah. And would be more neutral.
Yeah, and even more than just fat that we have on our bodies, which is kind of like reclaiming that is for sure something, especially in eating disorder treatment, we talk about like, you're not fat, you have fat, right? And I think even to push back on that a little bit and say, yes, we all have fat, and some of us are also fat. And so being willing to, because still in that, the way that we talk about that, then like, you're not fat, don't worry.
Right, still
don't worry,
minimizing.
goodness. I'm not trying to say something's terrible with you. I'm just trying to say that you have some fat on you, just like everybody else. Like, we can also push back and say, yeah, okay, everybody's got something on them, and
some people have more.
Some of us have more.
I don't know if this is a good time to go there, but I'm so curious. Because gosh, okay, so Erin, I know that you've been a part of some of those kinds of discussions around some people using the word fat about their own selves, and this is in a professional context. So in the eating disorder treatment world, at some national conferences and like bigger places where there's a lot of people serving, learning to be, and growing to be better providers and treatment providers for those with eating disorders. And so I know that you've been a part of some of that, and I wonder if there's anything else to add to it on that layer. Because I know from my standpoint, what I have grown in awareness, right, is that eating disorder professionals in the eating disorder world is absolutely not immune to having the weight stigma and the size discrimination that is in this world. And even when we opened Opal and we founded it on Health at Every Size, and we were putting that as a stake in the ground, like, it's kind of this, like, we say that to some people in the world, and then they look at us like, well, duh, of course you are. And then I'm like, no, that actually within the eating disorder world, that this isn't commonplace. And that's sometimes surprising to people. So I guess back to kind of like in the eating disorder world, I know that this exact thing that you're talking about, like people claiming the word fat and using that even in a professional context with colleagues of different body sizes is happening right now. Among the industry and in the eating disorder field. So I don't know if there's something you could give us to help us understand that, or if there's anything else that adds to understanding about what's going on and maybe where that's going to take. I would say eating disorder treatment, but then like even maybe society, maybe, I don't know. Is it a starting point? I don't know.
Yeah. So I think it's really sticky when we start using some of these controversial terms.
Okay. Yes.
And not everybody's on the same page about how we're using them.
Okay. Okay.
And so
fat being one of the thing you're saying is that's the controversial term, or the word fat is like the thing. Yeah.
I know that in some circles, some folks who are coming from that fat liberation standpoint identify themselves as fat, and they might introduce themselves as, hi, I'm so-and-so, I'm a fat cis woman. Okay. And sometimes people who are less familiar with that react to that, and they want to say like, oh, don't call yourself that. Mm-hmm. And when we find ourselves asking that, I'm like, what is it about me calling myself fat that you're reacting to, that you don't want me to call myself fat? Mm-hmm. Because what that says to me is that there's a judgment that you have about fatness, that it's not good, and I shouldn't call myself something that's not good. Mm-hmm. And so I think especially for thin providers, it can be a challenge to hear people identify themselves as fat and to kind of own it. And we might have this pushback and say, oh, don't do that. Don't do that. Mm-hmm. But really what we're saying is like, I'm afraid for you to do that. Mm-hmm. Or like, I have a problem with this word, or I don't want you talking down about yourself. And maybe I'm not talking down about myself by calling myself fat. Maybe I'm using it descriptively. So I think especially for folks with thin privilege, if you're uncomfortable with the word, explore it a little bit. Talk to people who use it and ask them why. Find out, why is that the word of all the words that you could use to describe your body? Why is that the one that you're choosing? And I think another one of the things that comes up, and I actually haven't had a lot of conversations about this because this is a really hard thing to talk to people about, is like, when are you fat enough to call yourself fat?
Totally. I'm glad you're saying that, because I think it's hard. Like, right? Yeah.
Yeah.
Is it, what is it in relation to what is that? Well, I don't.
Because this is all kind of we're talking about like terms that are all kind of by comparison, right? Yeah. Like my body is larger in comparison to this, or according to BMI charts, which are somewhat arbitrary and change occasionally, then I'm this. And if I had a BMI of 25 and like went to bed, then the night before
in the 90s,
the BMI shift, and like all of a sudden like I'm overweight in the morning, like now can I call myself fat? Like there's all these, it's kind of an arbitrary thing in some ways.
It's arbitrary, and I feel like it could get really complicated. And maybe I'm saying this surrounded by people with eating disorders as a clinician, but I feel a little bit worried sometimes that anyone would claim that when actually they don't have a healthy view of kind of where their body is because of their challenges with their body image. Yeah. And then use it not in a way that is neutral or descriptive. I don't know.
Yeah, and I think in the fat liberation world, like this has been a conversation, right? We talk about small fats and super fats, and we talk about the spectrum of fatness. And I think in fat liberation, I'm always a little bit worried when it's small fat people that are whose voices are centered, whose voices are heard the most. When we're not hearing from other fat folks in larger bodies. I think we run the same risk of centering privilege in conversations where we're deliberately trying to hear from other voices and from marginalized voices. In terms of the eating disorder world, yes, in working with eating disorder clients, we hear that fat word all the time. I feel fat. I am fat. I'm afraid I'll get fat. We hear this fear fat language. I think as clinicians, being able to let our eating disorder folks explore what fat liberation is, I think that's a great start. And I think if one of your clients starts using that term to identify, I would go with it. I do think that fat identity is something that we kind of find or come to or discover. And I think it would take a lot for an anorexic, or I don't like to say anorexic, but a person with anorexia to come out as fat. if they weren't fat.
Yeah.
You know?
Right. Right.
So I do think that maybe in the beginning, you know, and it could be too that this is a person who had a higher body weight prior to their eating disorder, and they just know this is where my body's going to go if I do refeeding. You know, like, you know, I looked like this before I stopped starving myself, and that's probably where I'm headed. So it could be that maybe they're in a more like ambiguous body weight category right now. And so as a provider, you might be uncomfortable labeling that. But I think as with any kind of identity, when a person starts to claim that identity, especially if it's something that's empowering, I think it's at least worth exploring and seeing, why are you using this term?
Yeah.
I think it's interesting in the context of treatment. Even today, I was supporting somebody that was really affected by something in body image group. Were you in body image group today, Carter? Okay. Anyways, I wasn't there either, but I just heard about it. But anyway, just one gal reacting to what somebody in a smaller size body stated about, oh, well, I'm just going to be fat and lazy, you know, or I'm just something like that. So putting the stereotype with the size, using the word, like, right, like really derogatory. And then the woman that was in a larger size body feeling just so reactive to that. And my like coaching and support in her panic was, you're here, you're in a place you can discuss that, like be like facing it and kind of and discussing it in community, right? Versus just the individual, even like individual client and provider relationship. But what happens in a milieu when these things are like being brought up or being said, then I was feeling like, oh, this woman, like she's maybe on the cusp of potentially claiming something for herself, right? And like identifying and going, this is who I am. And wait a minute, like working to figure out, well, wait, why is this person creating or stating a lot of fear of fatness when in comparison, she was doing that, right? Like, so, you know, that, wait, she's smaller than I am. So how can she say that? And what is she saying about me? And like that whole thing.
Right.
So I think the richness of, I feel like our, you know, Opal is a safe place that people can have those conversations and like do that interpersonally in a treatment environment, which I think that's just a gift to be able to do the work and be interacting with people of different sizes. And then, maybe like you're saying, like coming out with that word or naming that claim. I've never thought about it that way, honestly. So I think it's neat to think about.
Yeah. Two things with that. First of all, like coming out of fat is totally a thing.
Yeah.
So it's something that fat folks think about. And if you know, even fat folks who have been fat all their lives, treated as fat their whole lives, there's this dissonance and this reaction towards claiming this because it is intentionally and deliberately like accepting, you know, a very stigmatized identity and something that most people don't accept as a part of a person's identity. Most people view as like a choice or the result of being lazy or having certain eating behaviors or never moving, like all these stereotypes that we have. So I think that recognizing that, it's a process. It's not like I went to bed and I woke up one morning and realized I was fat. But also that there is this like coming to terms with like, okay, I'm going to face this very scary thing about myself. And potentially for someone with an eating disorder, that could be their greatest fear, right? Like their greatest fear could be realized. You know, this thing that we've been coaching them to like not fear might actually be true,
Right.
you know? So I think looking at what that process of coming out and accepting is important, and that it's not necessarily that coming out process might not be met with acceptance from people in their community. It could be something that people push back on and really aren't okay with their new lifestyle choice, right? Like, I mean, I hear this all the time. And I think in the context of a treatment environment too, I think as providers, we have a really neat opportunity in situations like that where clients kind of go back and forth about, well, I'm feeling stigmatized because my body is bigger than hers and she said this thing. I think sometimes as providers, we put it back on the clients and we say, hey, this will be a great interpersonal conflict opportunity for you to learn about and recognize. And I think sometimes part of our anti-oppression ally work can be to step in those situations and do some education about weight stigma.
What just happened?
Yeah.
Like, what was at play here? Why does this person think this or feel that?
Exactly. Like, what is motivating this fear of fatness? And what is, how does, my own discomfort and my own fears about my body, how does that heap oppression onto somebody else? We think it's all about us and what we're experiencing. And the reality is that, like, the body hatred that I harbor for myself, like, is mirrored to other people who have bodies that look like mine. Yeah. And so how much I give voice to that or credibility to that, it makes a statement. Whether or not we are intentional or we think that about others, it's just part of it.
Yeah, and that happens in social situations too, right?
Absolutely.
Like not just in treatment environments, right? How just two human beings might interact about their sides and what they might say. Totally does.
You're objectifying yourself. You're objectifying someone else inherently. Yeah. But I wanted to shift the conversation, just slightly to kind of how all of this plays out in an eating disorder setting. We were just getting into that a little bit, but for those that don't really know a ton about kind of eating disorder treatment, Julie, you said earlier that people would be surprised that there would be this groundbreaking thing to do eating disorder treatment from a health at every size point of view. But are there things that get assumed as well around how, someone's behaviors based off of their body size, kind of how they're treated within treatment?
Yeah, diagnosis in that way.
Exactly. That is kind of centered around these assumptions and these stigmas. Yes.
Yes. Where shall we start? I don't know.
I know, it's a lot,
I want to hear Erin's thoughts on it. What would you want to?
Well, in the eating disorder field, we're not immune. And our DSM is even written in a way with kind of a hierarchy of diagnoses and how we screen. And so, when a person presents with a body weight that's low, we do a certain screening. When a person presents with a body weight that's higher, we might not ask them the questions about self-starvation or purging that we might for a thinner person. So I think kind of right off the bat, depending on the philosophy that you follow in terms of diagnosis and assessment, we have groups of folks that their symptoms might be entirely missed because of how, like, the common practice in terms of our diagnosing. I see that over and over in research where there are like cutoffs for just being considered to be included in a study. And so like by definition, we're excluding some folks from even consideration for having an illness because their body weight is above a certain point or below. We might see that in binge eating disorder studies where people with underweight or normal BMIs like might be excluded from that particular study. Like they're, and so then
that's skewing the whole thing.
Yeah, it paints a picture that like everyone with binge eating disorder has this one body type when it's not the case. It occurs throughout the weight spectrum. And similarly, we might see studies on restriction, over exercise or something where they, don't accept anybody with a body weight or a BMI like above a 20, which paints this picture that everybody with restricting disorders from the research side presents in this certain way.
And I know you're really passionate about that, so I want to hear more about that. But okay.
Similarly, like we also see that in recovery studies where they might define recovery by having a BMI between 18.5 and 24, and everyone else is, they don't meet inclusion criteria. So then that means that we're only seeing a really narrow, excuse the pun, a narrow picture of what recovery from an eating disorder could look like. We're seeing essentially what it means to recover from an eating disorder into a body that's socially acceptable. And so, I think just, in terms of screening, diagnosis, it comes in. I can't remember the initial question.
That was it was an entry into some large things. But I feel like that answers it for sure. I think I was also wondering about kind of how maybe within a treatment setting people would get treated differently. I guess about, yes, how would people get treated differently? And I'm imagining, like you said, that's so much of the screening process, right? But
and I, to speak from a more personal point, so I have experience as a person who presented with what we call typical anorexia, which would be, a BMI that's underweight, and then also presenting like years later with atypical anorexia, where my BMI was in an overweight category. For myself, I know that my behaviors were exactly the same. I was restricting food. I was throwing up. The only thing that was different is that when I was underweight, I also had substance use tacked onto it. And then later I did not. And so in terms of behaviors, from the inside of that diagnosis, like I wanted help for the same things.
Right.
I think about this question a lot, like how does it impact us if for a thin person or a higher weight person? Because I went through treatment in 2 different inpatient centers. It was kind of like my own little, N of 1 experience, experiment, like kind of compare them. And the treatment was radically different. When I presented for treatment as a thin woman, nobody questioned my diagnosis. The only thing that I got from peers was like, because I wasn't as emaciated as some of my peers, it was the whole like, well, do you have anorexia or do you have bulimia? It was kind of this like, are you thin enough to be anorexic? It was those kind of questions. As a higher weight anorexic patient, when I presented for treatment, my therapist asked me why I was even in treatment.
Wow.
When I was in an inpatient 24/7 hospitalization setting with, medical complications, which is why I was in an inpatient setting, and in that setting, like I had a therapist that, not to harp on this poor therapist, but she said, oh, I think your real problem is substance abuse. I don't think that you really need help for an eating disorder. I think you need help for a substance abuse. And at that point, I've been clean for 4 years. So,
wow.
The willingness to kind of overlook, like, no, like, I'm here because I can't feed myself. Like,
right.
I promise. I'm not lying. I didn't think that inpatient was like such an amazing experience that I
for you to do.
really wanted to come back here and be strip searched and monitored in the bathroom. Like, this wasn't like summer camp,
Yeah.
So I think, in terms of the legitimacy with which you're treated by providers is a huge difference. And then, I mean, even things like, then what a meal plan looks like, my meal plan when I was treated as an underweight person was what you might expect for someone going through refeeding. And as a higher weight person, they put me on a restricted weight loss meal plan, even though I was doing refeeding. So I ended up discharging from a higher level of care and having to do refeeding from my inpatient meal plan, which that's a challenge,
it's a serious challenge.
So I think these, or like, when I was presenting as thin, I was restricted from exercise for until like I was orthostatically stable and things like that. And then as a higher weight patient, I was prescribed exercise and as like a part of my treatment, even though compulsive exercise was a part of my disorder. So I think thinking really critically about like, we want to treat the behaviors and the depression, the anxiety, like we want to treat it well regardless of how a person presents. So I do think it can be really different treatment experiences.
Oh my gosh, that makes me sick hearing about the difference that you would be prescribed some of the behaviors essentially that you're trying to heal from.
Yeah.
Which is just making me sick thinking about that. Yeah.
And then that offers just more and more legitimacy to that voice that says, you know, your body is unacceptable and it does need to change. And, you know, like, I mean, it strengthens. And I think for fatter people that present with eating disorders, this is a challenge because they go to doctors and they're congratulated on weight loss potentially in the beginning, or maybe entirely, you know, they could
never get seen as an issue.
Exactly.
Right.
Like it's something to be celebrated as, whereas, you know, for me, I always look at weight loss because it normally doesn't happen unless we're doing something. I always look at weight loss with like a little bit of suspicion, like, okay, like what's not right? It's not like, oh my God, what are you doing? Tell me about it. It's like, you know, usually weight loss happens when like there's a major shift. There's a change. There's a shift in behaviors or an illness. And so like being curious about that as opposed to automatically congratulating.
Because our bodies are working incredibly hard to keep us stable and safe. And so if our body has not done that by losing weight, then something's happening. Something could be off. Yeah.
And maybe not.
Maybe not.
Sure.
But maybe more times than not.
Right. Yeah. Yeah. So in what you were just saying, kind of what it might feel like for someone in a fat body to be, you know, told and battling in treatment that they should be losing weight, essentially. I'm thinking about kind of the internalized oppression that you have to be fighting against actively as you're fighting for recovery. And now I'm thinking too around internalized oppression around race as well and how all this gets thrown in. And I know that you are part of the, you might need to help me with the language around this, but with ASDA, you're working on the inclusivity committee. Is that right? Is that the right way to put it?
It's not the best name, but it's what we got.
What's that all about? What is ASDA, first of all, and what does that all mean? What would you rename it if you could?
I have thought so much about that. ASDA is our Association for Size, Diversity, and Health, and they're the organization that has trademarked this health at every size name. And they're a group that specifically fights for justice, not just in social justice, not just in terms of weight discrimination, but we're in the process of trying to take what we call a more intersectional approach to looking at weight stigma. And for those of you who are not familiar with that term, intersectionality is a concept developed by Black feminists that has to do with the fact that we experience our identities in combination. So I'm not just a woman. I'm not just a white woman. Like I have all of these overlapping identities that affect how those other identities are interpreted. And so for me to be fat as a woman means something differently than for me to be fat as a cisgender male. And so that's going to impact me differently. And similarly, we see things like that in terms of people of color, social class, all of those different identities. So I think for a long time, the weight stigma community or fat liberation community was focused just on weight to the exclusion of other forms of oppression, not realizing how it's different to experience fatness as a Latino woman versus fatness as a cis white male. And so thinking about the fact that we can't just look at any one of our identities alone. Anyway, ASDA for the last several years has been working on becoming a more intersectional organization, which is a challenge to do. And I'm a part of our inclusivity committee. I say that I kind of question that term because I have a friend who was like, inclusivity makes it sound as if like we wanted you white folks here in the first place, as if there was like, we invited you. So I think it's something really critical for us to consider in terms of like whose voices are heard, who gets to lead, whose voices are centered.
Because the word inclusivity then suggests, us white people are including you all in our conversation. Is that kind of what you're saying? Yeah.
Or that we even deserve a place at the table. Not in a pejorative sense, but there are some places where perhaps we don't need to hear from another thin white woman, perhaps. Now, I am definitely a advocate for finding how can we ally ourselves with other groups, other marginalized groups, and what does that look like? But I think any time that we're thinking about allyship or coming alongside someone, we need to really be critical about, am I speaking when someone else could be speaking? And how do I, like, what does allyship look like here? And am I truly being an ally, or am I just like making myself feel better about something, right? Like, so I think kind of on the ally side, we have to be really critical and self-reflective and open to learning when it comes to trying to make changes that maybe we really feel are good and are all well-intentioned, but being able to critically reflect on that is important.
Critically reflect and step back a little bit too.
Yeah.
I'm glad you say that, because it's like one of the reasons I wanted you here, like on this podcast, because just where I am, I feel like, I don't know if I'm going to use the right words in conversations around all this stuff. I like feel fearful that I may not have the right way to ally like with somebody. And so I'm trying to navigate that even in the ways that I might have some roles in the health at every size community right now professionally. I like still feel hesitant and scared that I'm going to say something wrong or do something in this whole thing. So I think that's like, I want Erin to come and talk about all this stuff because it's like I care so much, and I want to keep growing and learning and like be so I feel humbled by it, I guess, in that way, because I sit in a place of privilege as a thin white woman. So then I go, okay, what do I do with this? Like, I don't want to overstep and use my power, right? I don't want to. So I feel more hesitant lately in that way, and like trying to navigate what to do with that. I don't know. So I just say that.
I'm glad you brought that up too, because I don't know. So there's a great list of like characteristics of white supremacy. Just going to throw out that word. Yeah, just it's there. Okay, said it. But it's basically like, how do we critically look at white culture? And some of the things that are products of our white culture is like this, and maybe particularly for white women too, like this, like, I don't want to say the wrong thing or be misinterpreted, and so then I kind of step back and then I don't act. And so I think the willingness to step into that discomfort, like you just did, and say, hey, I'm still going to do this messy work, and I might mess it up. And that like perfection doesn't have to be the only option here. Because I think we can only do allyship imperfectly. And if we wait to be perfectly prepared, we are going to be those folks on the sidelines that are silently complicit. And so I think having the courage to step in and say, hey, I don't know what I'm doing. I mean, even on this podcast, like I've used the terms like men and women and not mentioned non-binary identities, and that's like,
you're conscious of that.
I'm growing to be, you know, and I have wonderful people in my life who remind me over and over and over, women and femmes, or, here's how your language can be improved, or, that was really kind of crappy, what you just said there. But I think part of this ally work is being willing to step in and being willing to be wrong and being humble when somebody says, hey, here's how to do it a little bit differently. So I think just by those acts of bravery and being willing to step in with your privilege and try and make some change, that's important.
Yeah.
I distinctly remember when Erin and I did a presentation on campus here at the University of Washington for the staff. And as we were preparing it and just sort of divvying up the slides, and I felt like even we, like in our relationship, we're sort of trying to navigate this of like, okay. And do you remember this?
Yeah.
And I think it may have even been, I don't know, when we were working on it and you were like, okay, well, I think you should take these slides because they might listen to you for these reasons. And then I think I'll take these slides because they might listen. And like just trying to like figure out what would, I don't know, just trying to make sure the audience could take it. Like, and you were like, there's some of these slides, I think they're going to take it easier from a dietitian versus from me and the social worker. And then sort of our body sizes we talked about, like, okay, I think they're going to take it from the thinner of us in this context, in this topic. And like, I mean, I don't know, that just felt like, I was grateful for the way that we were able to, I don't know, just like name those things and then like decide together, wait, we care about the content of this and getting this out to some of the staff here. That was more of like a wellness program for the UW employees. And it was like, ooh, I'm so excited about this. And we felt so unified in that. And then we were trying to like together figure out how the audience was going to receive us and the ways, who we were and who they were going to interpret us to be based on our credentials and our body size and our skin color and our education level and like, my goodness, so many things.
And I think that highlights why having multiple voices in this work is important, and I, why allyship and all those things can be like so crucial, because there are things that I can say as a fat woman where because of societal stigma, I won't be believed.
Yeah.
Like, and there are things that I can say and have, say the exact same thing, cite the exact same study. And I won't have that credibility. I will be seen as either trying to glorify obesity or trying to justify my own body. And so
you handed me those slides.
Yeah.
That's what I thought. Exactly. I remember that. Yeah. I was like, okay, well, I guess I'm the dietitian. Okay, if they'll hear it, I mean, okay.
Yeah.
But like, I'm up here with you. No, gosh darn it. She's the smarter one. Are you kidding me? Like, Erin's got way more to say about this. She knows the study. I'm just, what? I don't even know the study, basically. Like, that's the contrast. That's how, I remember feeling that. I wanted you to have way more time up there. I just was like, all those things. I remember feeling that. So.
And there are also, sometimes when I want to step into that space and I'm willing to take it, and other times when I don't feel like doing it.
You said that day, actually. I think I remember you saying that.
Yeah.
I can
have
see
to
that.
sort through all those different waters just to give a lecture.
Yes. Yeah. That's not, totally.
I was just reflecting on last podcast. We were talking about body image a ton, just kind of generally. And I don't think that we got to as much depth, of course, around this topic of intersectionality. But we were talking a little bit about kind of what it's like to go on a process with yourself around developing healthy body image, and what is that, and what is body neutrality versus body positivity, et cetera. Do you have any sense or anything that you'd want to add to the conversation around on how to develop kind of body image in these terms? It's a another big question.
Yeah. It's the whole concept of body positivity is a really charged topic right now in fat communities, because body positivity can be a place where fat liberation can be kind of hijacked a little bit. And we focus on acceptance and positivity for like a certain slice of the fat community, this kind of hourglass, femme, fashion.
Ashley Graham.
This kind of, that's acceptable, and that the idea that having body positivity means I put all this time and money and resources into presenting my body in a certain way, or that I have a responsibility, a moral responsibility to making myself as palatable as possible as a fat woman, right? That if I can present in this certain way, like my fatness will be, you'll see that I care about myself really, that I'm really working with what I've got here. And I think we kind of run that risk of body positivity becoming something where, like, as long as I still want to see myself as pretty, right? I still want to be beautiful, and that's part of accepting my body is seeing how beautiful I really am. And I think there's this other kind of pushback that, like, I don't owe you prettiness. I don't owe you a certain presentation. I don't owe you money that's spent on products or clothes. You know, I think there's a lot to be said for fat equality in terms of, like, access to clothing and, you know, things that we consider like really basic human rights. And then on the flip side, that, you know, at least for me in my journey, I'm really trying to get to a place where I can, like, sit in my body and be cool with it. You know, so for me, it's not just about, like, oh, I can, like, now appreciate this about the shape of my legs, or I can appreciate my hair. Like, you know, kind of the go-to things that we talk about in eating disorder treatment. Well, like, what can you like about yourself? Like, you know, even that, like, it's parceling our body up into pieces, right? Yeah. Like, and how often are we really talking about, like the bulge of my belly, or like the folds in my back? Like, how often are we talking about those things that are, like, really pathologized in our culture? It's all about, like, well, this thing most closely aligns with what society says is beautiful, so I guess I like that thing.
Right. Right. It's still, how are you most palatable? How are you most fitting into this idea of the male gaze upon you at all times, and et cetera?
Yeah. So, yeah, just like those, like, I think of steps and I'm thinking, like, I don't know, like, I'm not wearing sleeves right now. Like, that's a huge, for me, for, like, this woman who had to, like, unveil my arms one day in, like, 120-degree treatment in Arizona because I was so terrified of, like, how my arms looked. Like, to be, like, sleeveless here because I'm a little warm and this is how I'm most comfortable. I mean, that's huge. Right. And, like, and my arms are, like, way bigger now than they were when I was then. Like, I even have, like, this little, like, crease here by my, I'll call that a bicep, like, right? Like, to like, be able to, like, be here and, like this kind of, like, I want to be able to accept this with as much, like, gentleness and, like, comfort that I can. And then also look for those places where, like, I get to use my body as a tool for expression, like, you know, my tattoos or my hair color, or, you know, how I present my gender, you know, in terms of, like, my style, how I show up, all those types of things. So I think those kind of steps towards comfort and safety and self-expression are all things that are important for me, and things that are really hard to teach. But I think, you know, exposure, practice, all those things.
I love that idea. I'm just, like, my mind is popping in all these different directions around what it means to be embodied in a way that's not objectifying, but also allows you to kind of claim personality and style and all these things that are so significant.
In case you want to learn more about Dr. Harrop's work, you can find one of their publications in the journal Women and Therapy in 2018 on their own experiences of difference in treatment between typical and atypical anorexia. And you can find the link to this article in our podcast notes. And they have been working on developing a weight stigma training for healthcare providers to help educate about weight stigma and how it impacts clinical care. For this, Dr. Harrop is working with Dr. Lisa Erlanger at the University of Washington, as well as several colleagues from the Interprofessional Education Program. And if you are a University of Denver student, you are lucky. This spring, Dr. Harrop is teaching a social justice course on the intersections of weight stigma with other forms of oppression. And in case you want to connect up with Dr. Harrop through Facebook, they host a community called Recovery at Large, which provides peer support for higher weight folks with eating disorders. Thanks for listening. You can learn more about Opal at www.opalfoodandbody.com. And thank you to David Bozzi for editing, Camille Dodson for podcast support, and Erin Davidson for the Appetites music. See you next time. Thanks.